Are you over 60 and struggling with that agonizing shooting pain down your leg? If so, you have almost certainly been told by a doctor or a well-meaning friend to just go to bed and rest until it gets better. It sounds like common sense, doesn't it? But here is the absolute truth. That is the single worst thing you can possibly do. Staying glued to your mattress actually causes your critical supporting muscles to waste away. And within days, that weakening makes your sciatica pain significantly worse, not better. You are essentially trapping yourself in a cycle of pain. You do not have to take my word for it. Science has shifted completely on this issue. A landmark study published in the prestigious Annals of Internal Medicine proves it. The research found that patients who engaged in targeted, purposeful movement actually recovered 50% faster than those who simply stayed on bed rest. To get relief, you have to move. But you must move the right way. We are going to go through exactly how to do that today. But first, I want to know who is in this fight with us. Please, take a second right now to go down to the comments section. Tell me how old you are and what country or city you are watching from. It is so inspiring to see how many people from around the world are dedicating themselves to taking back their health, regardless of their age. Let's support each other. Comment below. All right. In just a moment, I'm going to reveal 3 gentle, science-backed exercises specifically designed to unlock your lower back and soothe that irritated nerve. We will start easy, but make sure you pay close attention to exercise number 1 at the very end. This is what I call the ultimate secret weapon. When done correctly, it can provide instant relief by releasing the compression on your sciatic nerve immediately. So let's get you moving again and get you back to living your life without pain. Exercise 3, the decompressor. As we age, especially after we cross our 60s, a quiet change happens inside our bodies. The protective discs in our spine begin to lose water. They dry out and shrink. Because of this natural degeneration, the heavy bones in your lower back start to collapse onto each other, directly crushing the delicate roots of your sciatic nerve. This constant heavy pressure is exactly what causes that intense electrical shock burning down your leg. To stop the pain, we have to create space. We have to decompress that area. Let us get into position. You can do this on a comfortable mat on the floor. However, if getting up and down from the ground is too difficult, you can absolutely do this right in your bed. Your safety is always the top priority. Lie flat on your back and relax your shoulders. Now, very gently, bring your right knee up toward your chest. Clasp your hands just below your knee and slowly pull it closer to your body. Stop the moment you feel a mild, relieving stretch in your lower back. Never push into sharp pain. Here is the absolute secret to making this work. It is all in your breathing. As you hold your knee, take a very deep breath in, pulling the air all the way down into your belly. Imagine you are inflating a balloon in your stomach. Then, as you exhale slowly, let your lower back melt completely into the mattress. That deep belly breath is what signals your nervous system to relax, forcing those tight lower back muscles to let go. It gives your spinal discs the room they desperately need to expand. Hold this gentle stretch for 20 to 30 seconds, taking those deep breaths. Then carefully lower your leg and switch to the left side. Exercise number 3 has just helped your spine take a much-needed breath. But what if that sharp pain is still shooting deep into your glutes and down your thigh? If so, the main culprit is actually a tiny hidden muscle that is literally strangling your sciatic nerve. Let us move right into exercise number 2. Exercise 2. The piriformis release. We just opened up your spine, but we are not done. Deep inside your buttocks, underneath the large glute muscles, there is a small muscle called the piriformis. For many people over 60, especially if you sit frequently, this tiny muscle becomes incredibly tight and goes into spasm. Here is why that matters. Your thick sciatic nerve runs directly underneath, or sometimes even right through, this exact muscle. When the piriformis spasms, it acts like a vice grip. It literally strangles the sciatic nerve, sending those agonizing shockwaves down your leg. To fix this, we must unlock your pelvis. You can do this safely sitting right in a sturdy chair. You do not have to worry about losing your balance on the floor. Sit toward the front edge of your chair with both feet flat. Now, take your right ankle and gently rest it across your left knee. Your legs should look like the number 4. If your hips are too stiff to lift your leg that high, simply cross your right ankle over your left shin closer to the floor. That is perfectly fine. Sit up nice and tall. For many of you, just sitting like this creates a massive stretch deep in your glute. If you need a deeper stretch, keep your back perfectly straight and lean forward slightly from your hips. Do not round your shoulders. Now, pay attention to your breath. Breathe in deeply. As you exhale very slowly, consciously tell your brain to relax your entire pelvic area. Let that deep muscle tension just melt away completely. Hold this for 30 seconds, then slowly switch legs. If you're doing this right now and you feel that amazing, deep, relieving stretch, please hit the like button and subscribe to the channel. It helps us bring this relief to more seniors around the world. Now that your spine and glute muscles are loosened, it is time for us to tackle the absolute root of the problem. We need to directly free the trapped nerve itself. This is where exercise number 1 comes in. Exercise 1. The sciatic nerve floss. We have finally arrived at the most powerful movement in this entire routine. Stretching your muscles is wonderful, but your sciatic nerve is not a muscle. It is a thick cord running all the way from your lower back, deep through your hips, and down to your toes. When this cord gets trapped by age-related changes, pulling on it with traditional stretches can actually make the irritation worse. That is exactly why clinical physical therapists use a breakthrough technique called nerve flossing. Clinical practice shows that this specific method can take severe sciatica pain from an agonizing 8 out of 10 all the way down to a 2 in just a matter of weeks. It completely outperforms standard muscle stretching. Think of how you use dental floss to clear out a tight space between 2 teeth. We are going to do the exact same thing to slide your sciatic nerve smoothly through those trapped areas in your lower back and legs. Sit right on the edge of your sturdy chair. Rest your hands on your lap. Now, slowly straighten your painful leg out in front of you. As you extend that leg and point your toes up toward the ceiling, gently tilt your head backward and look up. Then slowly lower your foot back to the floor. As your foot goes down, gently bring your chin down toward your chest. Look up as the leg goes out. Look down as the foot comes in. You are gently gliding the nerve back and forth, freeing it from the surrounding tissue without stretching it too tight. Do this smoothly and rhythmically for 10 repetitions. Now please listen to me very carefully. This is a delicate structure. Do not ever force this movement. If you feel a sharp zing or a sudden increase in pain, you are pulling way too hard. Back off immediately. You only want to feel a very mild tension. Just be gentle with your body. You see, the truth is finally out. You do not have to accept sciatica as a normal part of getting older, and you certainly do not have to spend your life lying in bed or relying on pain pills just to get through the day. By combining the gentle decompression of your spine, the deep release of that tight piriformis muscle, and the power of nerve flossing, you are taking complete control of your healing. You are actively reversing the damage. Living with sciatica is exhausting, but it is not a life sentence. You have the power to regain your flexibility and get your precious independence back. Do these 3 simple movements every single day and watch how your body responds. Before you go, I want to hear from you. Which of these 3 exercises gave you the most relief today? Let me know down in the comments. If this video helped you, please hit that subscribe button and share it with a friend who might be suffering. Tap the video on your screen right now for more exercises to keep you moving freely. I will see you there.